Namaste. In the previous class, you have studied functions of the blood and cellular elements as well as the fluid part of the blood, that's the plasma. In the cellular elements, you have studied about the RBCs. RBCs mean functions and its mean features you have studied. Today's class, you are going to study about the WBCs, platelets, and our blood group, ABO system. WBCs or white blood cells are also called as leukocytes. Leuko means white. Leukocytes because lack of hemoglobin pigment. This white blood cell differ from red blood cells in having a nucleus and not containing hemoglobin. Here in white blood cells it has a nucleus but there is no hemoglobin pigment. Most WBCs are amoeboid and can produce pseudopodia with which they can squeeze through the walls of the capillaries into the tissues. This process is called diapedesis. Here WBC having the special capacity, it can squeeze out or it can oozing out or it can come out from the blood capillaries and can enter in the tissue region. So this process is called as diapedesis. In the diagram we can see the process of diapedesis. Why this diapedesis shows only in the WBC, not in RBCs? Because WBC shows amoeboid movement or amoeboid shape and it to produce the pseudopodia. Means WBC it can change its shape and it produce the pseudopodia and through that it can come out from the blood capillaries. But RBC it having a particular shape, that is a biconcave, so it cannot come out from the blood capillaries. Because of this WBC amoeboid and can produce pseudopodia, so it can easily come out from the blood capillaries. So this process is called diapedesis. Based on shape and other characteristics, the white blood cells are classified into two major categories. First one is granular, second one is non-granular. In the diagram you can see granular means cytoplasm contains granules. And that's why it is called as a granular, and nucleus usually constricted into lobes. The nucleus having a lobes. In non-granular, cytoplasm without granules. In the cytoplasm there is no granules and it has a single large nucleus. Here nucleus is not in a lobe condition. In the granular WBC we can see the three types: neutrophils, eosinophils and basophils. Here neutrophils, the nucleus having 3 to 4 lobes, and eosinophils nucleus having 2 lobes, and basophils nucleus are large and indistinctly lobe, means we cannot identify the lobes properly here. Here neutrophils main function is it engulfs the bacteria, that is called as phagocytosis. Eosinophils main function is engulf bacteria as well as secretes the antitoxins associated with allergy. Basophils main function, it releases the chemicals that is called histamine for inflammation which dilate blood vessels. And these three types of granular WBC produced in the bone marrows. Non-granular WBC, first one is lymphocytes. It is a smallest of WBCs. It has a single large nucleus. And another is the monocytes. Nucleus is large, especially in a kidney shaped. Here lymphocytes, its main function is produces the antibodies. WBC means in there some categories are there. In that category only lymphocytes produces the antibodies, and monocytes its main function is ingest germs. And lymphocytes produced in bone marrow, lymph glands, that is in the spleen and tonsils. Monocytes are produced in bone marrow. So these are the different types of the WBCs, but in RBCs we cannot see these types. Next, functions of WBCs. First one is phagocytosis. This is a process in which most WBCs and particularly the neutrophils engulf particle like solid substances, especially bacteria. This is a defensive mechanism against disease germs. Here phagocytosis means engulfing the disease causing germs. So especially neutrophils shows this phagocytosis because WBC it shows the amoeboid movement, so it can as well as produce pseudopodia, it can easily catch the disease causing germs. So when there is a disease causing germs is there, in that condition neutrophils it goes near to the disease causing germs and it swallowing that disease causing germs. That process is called phagocytosis. Second one is inflammation. Inflammation occurs due to the reaction of tissues to injury and to localize invasion of germs. The inflamed spot has several characteristics, that is increased local heat, redness, swelling, pain, etc. Here the leukocytes, especially the monocytes and neutrophils, migrate through the walls of the blood vessels by diapedesis and fight against disease causing germs. They also destroy the damaged cells by phagocytosis. Here inflammation is there is a reaction of tissues to injury and to localize the invasion of germs, means entering of the germs. It causes some of the disease in our body. At that time it shows the some of the symptoms, that it may be the increasing the heat, or that spot will become red, or that spot will swelling of that spot takes place or cause the pain. So this takes place because of the reactions between the tissues and that germ disease causing germs. In that situation monocytes and neutrophils, they migrate near to that region and they shows the with the help of the diapedesis movement, and they shows the phagocytosis process. Pus is mainly composed of the dead white blood cells together with the tissue cells destroyed by the bacteria. I think you observe the pus. Okay, if there is any injuries there, after a few days you can see the light yellowish fluid will come out, that we call as a pus. What is that pus? Pus is nothing but it is a composed of the dead white blood cells. Along with the dead white blood cells, what are the tissue cells are there which are destroyed by the bacteria. That tissue cells and white blood cells will come out from our body in the form of a pus in the injured region. Next, formation of antibodies. The WBCs, especially lymphocytes, produce antibodies which kill or neutralize the germs or the poisons from them. Here antibodies, its main function is to neutralize or it kill the disease causing germs. So here you can see what is the antibodies and antitoxins. When disease causing germs gain entry into the bloodstream, they produce poisonous substances called toxins. Toxins nothing but is a poison. In response, the lymphocytes of the blood produce chemical substances called antibodies which circulate freely in the blood plasma. The antibodies are specific to the toxins for which they are produced. The antibodies act as antitoxins which neutralize the poisonous effect of the toxins. Here when the disease causing germs enters in our body, sometimes they will release the poisonous substance that we call as a toxins. For here WBC identify the types of the toxins and relate to that toxins, antibodies will produce. That antibodies are act as a antitoxins. These antitoxins neutralize that poison substances. Antibodies may persist long after the disease has been overcome and the person who has recovered becomes immune to the disease. This is the underlying principle of vaccination. So once we will get that once in our body antibodies will produce, that antibodies remains in our body for a longer time. The same disease causing germs, when it enter, these antibodies kill that disease causing germs. That antibodies remains in our body. How we are taking the vaccine? Here vaccination as its main function is, when we took the vaccine, it produces the antibodies to a particular disease, and that antibodies remains in our body for a longer time. Next, blood platelets, or it is called as a thrombocytes. Blood platelets are minute oval or round structures, non-nucleated, floating in the blood. It is a oval or round shaped structure, no absence of the nucleus, and is floating in the blood. The platelets are derived from some gained cells called megakaryocytes in the red bone marrows. In the red bone marrow, special cell is that is called megakaryocytes. The bud of the megakaryocytes separate and it acts as a platelets. These are the budded off from the megakaryocytes in a manner that each one is completely surrounded with the membrane. So bud of the megakaryocytes here act as a platelets, and their lifespan is 3 to 5 days and are destroyed mainly in the spleen. Here the platelets lifespan is 3 to 5 days and it is also destroyed by the spleen, and its main function is it is helpful for clotting of blood. At the site of injury, the platelets disintegrate to release a chemical substance that is called thrombokinase or thromboplastin, which initiates the process of clotting. Next, functions of platelets, or it is called as clotting of blood or coagulation. When a blood vessel is cut, blood escapes from it, but soon a clot is formed on the wound and the flow of blood is stopped. If it were not so, the injured person would bleed to death. Here, the blood clotting is very important process. If the blood will not clot, means the continuous flow of blood takes place and that person leads to death. Here we can see the steps of blood clotting. First one, the injured tissue cells and the platelets which disintegrate at the site of the wound release a substance that is thrombokinase, or also called as thromboplastin, or it is also called as factor X. So when there is a injured in that area, tissue cells and platelets disintegrate and it releases one of the chemical substance that we call as a thrombokinase or thromboplastin. Next, the thrombokinase act as an enzyme, and with the help of calcium ion present in the plasma, it converts a substance prothrombin, it is in the inactive form of the plasma, into thrombin, it is a active form. So here when the thrombokinase released, this thrombokinase acts as an enzyme and it react with the calcium ions which is present in the plasma and it convert the prothrombin. Prothrombin is present in the plasma, it is in the inactive form. It convert that prothrombin into thrombin. Thrombin is the active form. Next step, thrombin in the presence of calcium ions reacts with the soluble fibrinogen of the plasma to convert it into insoluble fibrin. Fibrin is a solid substance that forms threads. These microscopic threads of fibrin are sticky and form a network at the wound. Here, the thrombin in the presence of calcium ion, it reacts with the fibrinogen. It is also present in the plasma. It is a type of protein. Here, the fibrinogen is a soluble form. When the thrombin in the presence of calcium ion, it reacts with the fibrinogen and convert that fibrinogen into fibrin. Fibrin is the insoluble. This fibrin is become a solid substance. It form a thread on the surface of the wound. That thread, it is sticky in nature and it act as a mesh at the wound. So it prevents the flow of blood to the out of the body. So fourth one, The blood cells are trapped in the network of the fibrin. The network then shrinks and squeezes out the rest of the plasma, which is in the form of a clear liquid that we call as a serum. The solid mass which is left behind is called clot. Yes, here when the mesh will form, the blood cells trapped in that mesh, and afterwards that network or mesh shrinks, squeeze out the rest of the plasma, and that plasma we call as a serum because there is no fibrinogen. Fibrinogen is utilized for the clotting of blood. So in the plasma there is no fibrinogen content. So that is called as a serum. And whatever the solid mass is left behind, it is called as a clot. So these are the steps of clotting of blood. So in the diagram also you can observe, it is simple manner of the diagram of clotting of blood. Next, blood transfusion. Sometimes it becomes necessary to inject blood into the body of patients undergoing surgical operation. This is called blood transfusion. The blood taken from a healthy person is called donor, is introduced through one of the patient veins, but for doing so it is necessary that the kind or the type of blood to be transferred should match or to be compatible with the type of blood of the receiving person. Here a person who is giving the blood, that person is called as donor. Person who is receiving the blood, that person is called recipient. The blood transfusion is necessary while doing the surgery. So in that condition, while giving the blood from one person to another person, we have to first check blood groups, whether is it matching the recipient or not. Here donor blood and recipient blood should be match each other. So that's why before blood transfusion we have to check the blood groups, whether is it matching or not. The concept of blood grouping was discovered by Karl Landsteiner. RBCs of human beings have specific proteins on their surface. These proteins are called antigens. The plasma of the blood has its complementary antibodies. Here on the surface of RBCs we can see the antigen, and in the plasma we can see the antibodies. There are two types of antigens we can see, antigen A and antigen B. Next, ABO system. According to the ABO system, the human blood is classified into four types: A, B, AB and O. Here we can see in the chart, we can see the donor as well as the recipient. Blood group of donor and blood group of recipient. Here those who are having the blood group A act as a donor. They can give the blood to the blood group A as well as blood group AB. A person having blood group A, he can give the blood to those who are having the blood group A and those who are having the blood group AB. Next, a person having blood group B, he can give the blood to those who are having the blood group B and those who are having the blood group AB, not for A and not for O. And those who are having the blood group AB, they can give the blood to the only those who are having the blood group AB, not for other groups. And those who are having the blood group O, they can give the blood to all the types of blood groups. It may be A, B, AB and O. So this is the blood group of donor and recipient. Here you can see AB blood group act as a universal recipient. O blood group act as a universal donor. Means AB blood group, those who are having AB blood group, they can receive the blood from any blood groups. And O is called as universal donor, means they can give the blood for any group, but they have to receive the blood from O only, but they can give the blood to any groups. Because here the reaction between the antigen and antibodies takes place, but in the blood group AB there is no antibodies, so there is no reaction between the antigen and antibodies, as well as in the blood group O there is no antigen, so they can give blood for any types of the blood groups. That's why AB is called as a universal recipient, O blood group is called as a universal donor. Next, RH system. The blood of most people contains a substance called RH factor, or it is RH means RH stand for rhesus, our common monkey, in which the factor was first discovered. It is called a rhesus factor. When the blood of such an individual is transferred into the person lacking it, the blood of the recipient develops an antibody for RH substance within about 2 weeks of transfusion. Now, if a second transfusion be given to such RH negative person, the antibody produced by the first transfusion causes a reaction with the transfused blood, which may even lead to death. This is similar to the development of an allergy. Here, a person, those who are having a RH factor, that person is called as RH positive. Those who are not having RH factor, we call as RH negative. You observe A positive, A negative, B positive, B negative. So this positive and negative is given by the RH factor. Those who are having the RH factor, we call as a positive. Those who are not having the RH factor, that we call as a negative. So that's why during the blood transfusion, a positive person blood has to give for the positive person only, and negative person blood has to give for the negative person only. So if suppose the positive person is given for the negative person, so what will happen? So here, when the blood of such an individual is transferred into the person of RH negative, the blood of the recipient develops an antibody for RH substance, because in negative person body there is no RH antigen. So if he receive the blood from positive body, in the negative person body, RH antibody developed. So in the first time nothing will happen. That RH negative person, second time he will take the, if he take the blood from the positive person, so whatever the RH bodies develop already in his blood, the reactions takes place between that RH body, RH antibody and that transfused blood, and that person may lead to death. So that's why be careful during the blood transfusion. In today's class, we have studied main functions of WBCs, that is diapedesis, phagocytosis, its main function, that is diapedesis, phagocytosis, inflammation, production of antibodies, etc., and its types of WBCs, that is granular and agranular, and in that basophili, neutrophil, eosinophils, lymphocytes, monocytes, etc. Also, we have focused on platelets, the main functions of platelets and steps which are involved in the clotting of blood, as well as we have studied about the blood transfusion, ABO system, RH system.